That I understand the feelings of these victims and their families, and I am deeply sorry for the pain and the loss and the suffering of those victims and their families. And grateful though I am to the hundreds of thousands of healthcare workers and many other public servants and people in all walks of life who helped to protect our country throughout a dreadful pandemic, I do hope that this inquiry will help to get the answers to the very difficult questions that those victims and those families are rightly asking. Can I, for the avoidance of doubt, make it absolutely clear I haven't removed any WhatsApps from my phone, and I've given you everything that I think you need. We may have made mistakes. I don't want to try to anticipate the discussion, which I'm sure we will get into, about the timings of MPIs, of lockdowns. Inevitably, we got some things wrong. I think we were doing our best at the time, given what we knew. Given the information I had available to me at the time, I think we did our level best. Were there things that we should have done differently? Unquestionably, but I would struggle to itemize them all before you now in a hierarchy. So I take personal responsibility for all the decisions that we made.
Do you take responsibility for whatever my lady makes of the speed of the government's response in January, February, March of 2020?
Of course.
And the way in which the various moving parts of the government, the advisory committees, the departments, the agencies and so on responded?
Of course.
Do you take responsibility for the lockdown decisions, whichever way they went, and their timeliness, whatever my lady makes of them? The manner in which patients were discharged from hospitals into the care sector?
Of course.
The explosion of the virus within the residential care sector?
Yes.
The general speed at which the restrictions were eased?
Yes.
The Eat Out to Help Out scheme? And then, latterly in 2020, the decision not to introduce a circuit breaker in September or October, or to introduce a tier system earlier when the prevalence of the virus was lower, for good or ill.
Yes, though we did have local restrictions from a very early day.
We did. Why do you think that we had the rate of excess deaths in this country that we did ultimately have?
As I say, I think that the statistics vary, and I think that every country struggled with a new pandemic, and I think the UK, from the evidence that I have seen, was well down the European table and obviously even further down the world table. If I had to answer why I think we faced particular headwinds, I would say it was irrespective of government action. We have an elderly population, extremely elderly population. We do suffer, sadly, from lots of COVID-related comorbidities. And we are a very, very densely populated country, the second most densely populated country in Europe, and that did not help.
You're obviously extremely well aware of the argument that the lockdown decisions themselves, cumulatively and individually, contributed to the number of excess deaths. What do you say to that?
I say that I don't know, but I'm aware of the arguments that are made. What I would say respectfully to people is that they were very, very difficult decisions, and the issue of the timeliness of lockdowns was clearly one that we considered very hard at the time.